Well, thank you. Thank you very much for everyone coming out on this wonderful, beautiful, sunny day. I appreciate all of you joining us here today. I want to especially welcome our United States Representatives Caston, Underwood, Foster, and we also have the Mayor of Bartlett is with us here, Kevin Wallace. Thank you all for joining us, and thank you for your service in Washington and the Congress. Extremely challenging times, and really appreciate your commitment to public service. Today, we're pleased to announce the expansion of the DuPage County Health Department's COVID-19 Community Vaccination Clinic and its relocation to the DuPage County Fairgrounds. DuPage has always demonstrated a commitment to serving our residents during challenging times. We have seen our schools, businesses, hospitals, and local government come together with a unified mission to protect our communities. I've been proud to work closely with the health department as together we have navigated the COVID-19 pandemic and worked to reduce its impact on our residents. Right now, I'm also proud to say DuPage County is leading the collar counties in getting vaccines into people's arms, with over 100,000 doses administered to residents and 2.88% of its population now protected with 2 doses. But you know what? That's not enough. I'm speaking now to every person who is elderly, disabled, or on the front lines with daily public contact. If you are frustrated or afraid, wondering when or how you'll be vaccinated, I want you to know your DuPage County leaders are working furiously to bring more vaccine to this county and get you vaccinated as fast as we possibly can. With our local healthcare partners, we have 96 providers approved as vaccination sites who can deliver at least 50,000 doses per week. But this week, again, the county is receiving only 10,000 vaccine doses from the state, which significantly hinders our ability to vaccinate residents. While every jurisdiction across the country is experiencing significant challenges tied to the lack of vaccine available, I'm especially frustrated with the Illinois Department of Public Health's lack of transparency. Despite repeated requests for information about the strategy to distribute the vaccine that is coming into the state, we have not been able to determine whether DuPage County is receiving our fair share, or, frankly, how the state is even deciding where the vaccine should go. It appears that the state is sending vaccine to pharmacies, state-run sites, and possibly other sites, and we have very limited visibility in this process. Limited visibility. Think about that. Think about driving in the snow as a metaphor. As county leaders grappling with this great health challenge, we're driving our car trying to get vaccine to folks most in need, and the state's thrown a blanket on the windshield. We've been told not to worry about what we can't see, these vaccines sent somewhere else, because they don't impact each county's allocation. With a limited supply of vaccine in the state, every decision about where to send vaccine impacts all of us. While we are grateful for every dose of vaccine that gets to a DuPage County resident, we cannot adequately plan when the state can't or won't tell us where they are distributing vaccine. Our own supply, week to week, is far too little and incredibly inconsistent. We cannot adequately serve our partners, and they cannot make appointments for the public if we don't know, week to week, how much vaccine we will receive. We understand the federal government has committed to a 3-week forecast of vaccine availability and have shared this with the state. But the state doesn't share it with us. We cannot effectively serve our residents if we don't have the information we need. Here in DuPage, we're committed to ensuring those in our communities at higher risk for severe outcomes related to COVID-19 and those who have been most impacted by this disease can be vaccinated. Beyond the amount of vaccine administered, we have been unable to access this data that is reported to the IDPH by each vaccine provider. We've repeatedly requested information from the state about the demographics of those who have been vaccinated. We can't get it. We can't get that information. Once again, we're driving blind. And finally, there are billions of dollars that went into developing and distributing the 2 safe and effective vaccines that we currently have. But here on the ground, where we're distributing and administering shots, very little attention, support, or resources are focused on the last mile of the vaccination campaign. And it's in that last mile where lives are saved. As the agency responsible for assuring that these vaccines are administered to our residents, I am concerned that the DuPage County Health Department has so far received zero state or federal funding specific to bolstering our vaccination system. The state of Illinois recently received $90 million to support vaccination activities and appears to be making just a fraction of those dollars available to the local health departments and those who are on the front lines. DuPage County expects to receive just barely $2.5 million for these incredible efforts. So again, I remind you, despite the lack of visibility and in the face of too little state or federal support, this county stood up 2 countywide COVID testing sites with little or no state support, and yet we lead the collar counties in the percentage of residents vaccinated. But you know what? That's not enough. It's not nearly enough. And so I call on our state and federal elected officials to recognize the tremendous needs of the local agencies to assure the rapid and efficient vaccination of our residents and to commit to supporting these efforts with additional funding. Join us in asking the IDPH to remove this cloak of secrecy, share the data, and allow us visibility. Transparency is the hallmark of good government. What IDPH is doing is the antithesis of good government. This mission is too important for any of us to be driving blind. The administration of vaccine to hundreds of millions across our country in the coming months is the challenge of our lifetime. I sincerely hope leaders in Washington and Springfield will commit the resources to ensure our success. I want to thank our healthcare partners. We have a strong, committed DuPage County hospital and healthcare network of unique public and private partnerships that facilitate our effort to vaccinate our residents. We call, they answer. Without them, our efforts would not be nearly as successful. Finally, when certain leaders say, that has been said and quoted in publications, that this vaccination process is going to take 18 months, when the state bureaucracy takes way too long to make basic foundational decisions about contractors and authorized administrators, when we can't get answers to guide our efforts at the county level because of a huge lack of transparency, I say there is no room for error here in this final phase of this pandemic. None of this is acceptable. We will get 80% of the population vaccinated by July. This is not a goal. This is not our objective. This is our imperative. Our children are going back to school, in-person learning, 5 days a week. Businesses are going to return to a comfortable normal. Our communities, our society expects no less. I am continuously and vigorously advocating that DuPage County, the second largest county in the state with a diverse population, receive its fair share, per capita, of vaccines needed to ensure the health of nearly 1 million residents. Now I am pleased to invite Sam Tornatore, head of the Board of Health, the Board of Health president, and a member of the county board representing District 1 to say a few words. I'd also like to recognize Greg Hart, county board member from District 3, is here. Sam.
Good afternoon. Thank you, Chairman, and thank you for your advocacy on behalf of the Health Department and the citizens of DuPage County, and welcome members of Congress, and thank you for your advocacy for us in Washington as well. Today, I'd like to thank the DuPage County Health Department for their exceptional leadership throughout the past year in leading our county through this unprecedented time. The COVID-19 pandemic has had a tremendous impact on all of us. Since March, there have been a total of 69,861 confirmed cases in DuPage County. Sadly, we have lost 1,135 of our residents to this deadly virus. Furthermore, we have seen this virus disproportionately impact minority communities across Illinois, including here in DuPage County. The Health Department is committed to supporting local schools and businesses through its COVID-19 school and business teams. These teams have assisted 465 DuPage County schools and daycares through more than 8,600 contacts and 2,300 DuPage County businesses through more than 12,000 contacts to address questions or provide support with reports of COVID-19 cases. Since the pandemic began, the DuPage County Health Department has been planning and preparing for community vaccinations. We are grateful to finally have this life-saving vaccine available to begin this next phase of vaccinating our residents. We understand people's frustrations with appointments not being readily available at this particular time. Nevertheless, we recognize the incredible progress DuPage County has made in this effort, with over 100,000 vaccine doses administered despite the vaccine supply challenges. In their plans, the DuPage County Health Department has built on the lessons learned from past community vaccination responses to infectious diseases such as polio in the 1950s and H1N1 in the mid-2000s. While each pandemic has had its own challenges, COVID-19 presents some of the greatest challenges, from a physical distancing requirement to vaccine supply and many factors in between. The Health Department has been mindful to plan for such obstacles. The community vaccination plan developed is both flexible and scalable based on vaccine supply using a decentralized community vaccination model. Recognizing the large-scale effort necessary to vaccinate county residents, the DuPage County Health Department realized early on it would require a strong network of partners, which are fortunate that we have with us in this endeavor. The private and public partnerships in DuPage County ultimately provide the necessary infrastructure to equitably vaccinate every DuPage County resident once vaccine supplies increase. These partnerships allow residents to access vaccine through convenient locations such as health systems, medical groups, and retail pharmacies. To discuss the expansion of the DuPage County Health Department's COVID-19 Community Vaccination Clinic, please welcome our Executive Director of the DuPage County Health Department, Karen Aiella. Karen?
Thanks, Sam. And thanks all of you for coming out today. On behalf of the DuPage County Health Department, I'd like to thank Chairman, County Board, Board of Health, and our residents for their continued support through the COVID-19 pandemic. This pandemic does present the greatest medical and public health challenges we've seen in decades. But during the past year, the DuPage County Health Department staff has worked tirelessly to minimize the impact of this pandemic on our communities. Our work to provide fact-based information and education about this disease and the vaccine, our regular briefings with community leaders, our COVID-19 testing site, as well as our case investigation and contact tracing have all been provided by these public health heroes here at the Health Department. These efforts continue, and at the same time we're here today because we now have not one but two life-saving vaccines available to support our efforts in eliminating this virus. This virus provides us the best strategy yet to reduce severe health outcomes and hospitalizations, to reduce deaths while returning our communities, our businesses, and our families to a sense of normal. In other words, we are finally starting to see a light at the end of the tunnel. As the chairman mentioned, this is our last mile challenge, and there is much more work to be done. But please let me share for a few minutes how we will effectively and efficiently get vaccine out when available. Our community vaccination plans have developed over months and utilize this centralized facility in combination with a decentralized approach for vaccine distribution to promote equitable access to vaccinations across our community. Not only will we be able to expand our existing health department clinic using this great facility, we also will be leveraging almost 100 healthcare provider partners in the community to ensure widespread access to vaccine as it becomes available. To achieve this, we have built our COVID-19 community vaccination plans upon the existing public and private partnerships within the county. Together with our county and community partners, we are expanding the infrastructure to vaccinate as many eligible people as quickly as possible. As vaccine is received, and you heard about the significant challenges we are facing, we are allocating the majority of our supply to our partner providers. This allows residents to schedule directly with their healthcare providers, their hospitals, or their pharmacies to receive their vaccination, or with us. You've heard it, and I'm going to repeat it. As of today, we have partnered with 96 locations for residents to ultimately access the vaccine. However, due to the sustained limited and unstable vaccine supply, only 42 partners are able to receive allotments. Even with that, and those challenges around vaccine supply, we are pleased with our county's progress. As of today, as Chairman Cronin mentioned, DuPage County leads all metropolitan Chicago counties with 2.88%, or over 28,000 persons of the population fully vaccinated with 2 doses. In addition, we have more than 100,000 individuals, 100,915, and yes, we are counting every single one, to have doses administered to our county residents. Again, we are pleased with this, pleased but not at all satisfied. Currently, we are receiving between 10,000 to 14,000 doses of vaccine per week, which means we can only administer that number of doses per week. We are fortunate to have a robust network of healthcare providers in DuPage County who are committed to administering vaccine as soon as it is available. And when doses do arrive to DuPage County, they do not sit in freezers for extended periods of time. Instead, appointments are opened, links to schedule an appointment are sent, and doses are administered into the arms of those in the eligible groups. Vaccinations for both Phase 1A and 1B priority groups continue at a steady pace. However, the limited vaccine supply is hindering everyone's ability to vaccinate large groups. But we know over the next and few coming months, the vaccine supply will increase. And that's when we're confident that the network of providers that we have built in the county will get this life-saving vaccine administered into arms of DuPage County residents as quickly and efficiently as possible. Now, as a reminder, the health department has been operating a community vaccination clinic since the third week of December. We actually opened our clinic the week of the Christmas holiday. This centralized clinic, offered at our main location right across the field, has focused on providing vaccines to non-affiliated healthcare personnel in Phase 1A. Recently, we're pleased to announce that our clinic surpassed 10,000 doses administered, and we continue working through the thousands of remaining healthcare personnel on our registration list. But as has been said before, we must do more. And so we identified the DuPage County Fairgrounds as a preferred location for our expansion due to its central location, easy access, as well as the safety it provides our staff, volunteers, and the residents being vaccinated. We have sincerely appreciated the support of the fairgrounds staff, led by Jim McGuire, and are grateful for their partnership and look forward to this continued relationship. Currently, our efforts at our clinic have topped out at vaccinating up to 2,000 eligible persons per week, or roughly 400 individuals per day. By moving the health department's COVID vaccination clinic to the fairgrounds, we will have the potential to administer up to 1,000 vaccine doses per day, or 5,000 doses per week. These outcomes, however, are only projections until we have a vaccine supply to make them a reality. I want to reinforce and emphasize that this clinic will be open by appointment only to ensure the safety of everyone coming to the clinic and to ensure that we have an adequate supply. Appointments must be scheduled in advance, and no walk-in or unscheduled appointments will be accepted. While waiting for a vaccination appointment, we also encourage anyone to visit our website for updates. Due to the challenges with vaccine, we're also encouraging our residents to register through other providers, including pharmacies, healthcare providers, or medical groups, and to take advantage of the vaccine at the first available opportunity. Finally, I'm pleased to announce the Health Department has expanded our call center to support residents with vaccine registration and to answer any COVID vaccine-related questions. Residents who may not have access to the internet, a computer, or need support with registering, including language assistance, should call 630-682-7400, and a representative will assist them. Without a doubt, we will get through this pandemic. And we are convinced that the best way to get through this is through partnership, support, and a shared and common goal. We have appreciated the support of our county board chairman, the entire county board, our Board of Health, DuPage County mayors, our state legislators, and our federal elected delegation. Today, I am so very pleased that several members of that federal delegation are able to join us and provide us some comments. It is my pleasure to welcome all three, the U.S. Congressman Sean Casten, representing the 6th District, Congresswoman Lauren Underwood, representing the 14th District, and Congressman Bill Foster, representing the 11th District. Thank you again for being here today. We appreciate your support, and I'd now like to invite Congressman Casten.
Thank you. Thank you so much, Karen. Thanks to all who are here. Thank you, Chairman Cronin. We are extremely fortunate in DuPage County. You've heard it a number of times that we have the highest vaccination rate of any of the counties in the Chicago region. One of the top rates. You'll tell me where we are statewide. I know we've been consistently one of the top rates statewide. And I agree with Chairman Cronin. We're nowhere near where we need to be, but we can take pride in the the competence of your team, Karen, and the infrastructure we've put together here relative to the other states or the other counties in the region. My height and my vertical jumping ability means I'm never going to dunk a basketball. My height and my vertical leap means I'm never going to dunk a basketball. And I've long since resigned myself that I got to play the cards I'm dealt. We need to be honest about the cards we've been dealt in this moment. There are way more people who have this vaccine, this virus, than anybody wants right now. There are way too many people who have died. We got to this point because we did not have a coherent national response to this virus. We made states compete first for PPE, then we made them compete for testing, and we've made them compete for vaccines. It shouldn't be that way. Fortunately, we're starting to move forward on that right now, but there is not a person out there at any level of our public health structure who is happy about the number of people who are infected, and there isn't a city, there isn't a county, there isn't a state who doesn't want more vaccines right now. And so my hat is off to everybody in the public health department for being exceptional, for working under extremely trying circumstances. I would ask everybody who is feeling frustrated, own that. You should be frustrated. But please be patient with the folks who are working ridiculous hours and sacrificing to make sure that we can be vaccinated in this moment. Because ultimately, our measure of success is not going to come because we've got the best vaccination rate of any county in the country. Our measure of success is going to come because the virus isn't spreading. The virus doesn't know where county lines are, where state lines are, where city lines are, and we have to make sure that we trust our public health officials to make the most of a system that ain't perfect, but it's the system we have, and when we are through this, let's hope that we can all work together to redouble our commitment to building a more robust and equitable public health system. Thank you, and it's now my pleasure to introduce my colleague, my friend, and legit public health expert, Lauren Underwood.
Well, thank you, Congressman Caston. I'm Lauren Underwood. I have the honor of representing the 14th Congressional District, and I'm truly very excited to be here at the DuPage County Health Department's Community Vaccination Clinic. Thanks to the tireless work of countless scientists and public health professionals, including those right here at the DuPage County Health Department, we are finally gaining the upper hand in the battle against COVID-19. But we know we have a long way to go before everyone who wants a vaccine can get one. Web-based appointment signups are filling up faster than people can register, and local health departments are overwhelmed with phone calls from people wondering where to go for a vaccine. This process, it's been difficult. And the bottom line is that our current vaccination process needs to be further scaled up as more vaccine supply becomes available. To address these challenges and carry out an efficient COVID-19 vaccine campaign that prioritizes the people who need it most, Congress needs to act swiftly and boldly. The next relief bill must include significant funding to accelerate vaccine administration, with a particular focus on providing vaccine doses and outreach to ensure that nobody is left behind. We also need to fund the workforce that will carry out the vaccination efforts, as well as the testing, contact tracing, and other critical initiatives to control the spread of the virus. I've introduced two bills, the Community Immunity During COVID-19 Act and the Health Force, Resilience Force, and Jobs to Fight COVID-19 Act, to make the investments that will be needed to end the pandemic, prevent the next public health crisis, and ensure a robust economic recovery. This pandemic has shown us that when we come together, we're capable of anything. The expanded community vaccination clinic here in DuPage County represents a tangible step toward beating COVID-19. I remain committed to ensuring that our community has the federal resources it needs to vaccinate efficiently and equitably, and help our economy build back stronger than ever. Thank you so much, and it's my honor to now welcome my colleague from the Illinois 11th District, Congressman Bill Foster.
Well, thank you all. I'm Bill Foster. I represent the 11th District, which has a total of 5 counties in it, and it has the second, third, and fourth largest cities of Illinois in the form of Aurora, Joliet, and Naperville. And I can assure you, if it's any consolation, that there is not one county in my district that thinks it's getting enough vaccine. It's just, that's the reality. Now, we've understood the basic numbers across our country. And we have a lot of capability. In a normal year, just the flu vaccine, we vaccinate 3 million people a day using the network that we do, which is very diverse, but that's a big number. And in Washington, when we saw this crisis coming in the early spring, and we saw the scientific promise of the early results on vaccines, we voted a bunch of money and gave a bunch of explicit instructions to put that money in every competent vaccine manufacturer. And not all of them have crossed the finish line first. The 2 that have, Moderna and the Pfizer-BioNTech, are delivering vaccines over 1 million doses per day, ramping up towards 2 million doses per day nationwide. And that's the battle that we had to win. And there's some other good news. It looks like by the end of this month, we have a good chance of getting a 3rd vaccine that won't require the gymnastics or the refrigeration here. And there may be additional vaccines on a time scale that will really help with the overall national goal of getting everyone who wants a vaccine to have a vaccine by the end of June. And I think it's going to be a stretch, but I think that is our national goal, and I think we can achieve it. Partly because of the strength that we have in the last mile with, groups like this. And everyone that you don't see here because they're all of the other providers. I mean, what was the number of providers that you had? 96. That is the diversity and the strength of the last mile in this country, and we see it everywhere. It's in every county that I represent, and I want to thank you all for just gritting your teeth, putting up with the shortage that everyone knew was coming, and doing your best to make the distribution equitable and as fast as we can possibly make it.